Hello, my name is Dr. Daniel H. I'm an associate professor with the Faculty of Education at Simon Fraser University and president of the Confederation of University Faculty Associations of British Columbia, CUFA BC. CUFA BC is the provincial voice for more than 5,500 university professors, instructors, lecturers, and academic librarians at 5 research institutions across the province. We work with faculty associations at Royal Roads University, Simon Fraser University, the University of British Columbia, the University of Northern British Columbia, and the University of Victoria. I would like to respectfully acknowledge that the land on which CUFA BC's office is situated is the traditional, ancestral, and unceded territories of the Coast Salish peoples. We acknowledge, with respect, the diverse histories and cultures of the Squamish, Tsleil-Waututh, Musqueam, and Stolo nations of this province. We recognize the inherent Indigenous rights and title, the implementation without reservation of the UN Declaration on the Rights of Indigenous People, and our support for the 94 calls to action by the Truth and Reconciliation Commission. We are here today to present the winners of the 2022 CUFA BC Distinguished Academics Awards. Each year since 1995, CUFA BC honors the outstanding scholarship and public policy contributions of distinguished academics in BC. Academics whose research and scholarly activity have made significant contribution to the community beyond the academy. We believe that the ideas that flow from universities contribute in significant ways to the public good, to our citizenry, our democratic landscape, our intellectual life, and our economy. The awards demonstrate the necessity and vitality of public universities, research, and scholarly activity. I am pleased to present the winner of the 2022 CUFA BC Early in Career Award to Dr. Travis Salway. This award recognizes significant contributions to the non-academic community made by faculty members who are at an early point in their careers. It represents the admiration of colleagues from across institutions, disciplines, geographic borders, and beyond. Dr. Salway joins us to talk about his research.
My name is Travis Salway. I'm an assistant professor in the Faculty of Health Sciences at Simon Fraser University.
Thanks for joining us today. Can you start by telling me a little bit more about your research?
Yeah, so I am a social epidemiologist, which means I try to understand how patterns of health vary across social groups. And the social group that I research in particular are two-spirit, lesbian, gay, bisexual, transgender, and queer, or 2S LGBTQ people.
So you're recognized for your contributions to understanding structural health, inequities, and mental health related needs within the two-spirit and LGBTQ plus populations. So can you tell me about your work with the Reaffirm Collaborative Research Group?
Yes, so Reaffirm Collaborative is an interdisciplinary group. So we work with healthcare practitioners, public health administrators, but also people from social sciences in order to understand the distribution of mental health among 2S LGBTQ people. We know, and we've known for some time now, that 2S LGBTQ people experience a much higher burden of several definable mental health concerns. For example, depression, anxiety, substance use, struggling with unwanted substance use, and suicide. And we are interested in understanding how are those patterns, those gaps in health changing over time and place? Are they getting better? If not, why aren't they getting better? The second component of that work is really trying to dig into some of those mechanisms or the means through which 2S LGBTQ people experience these disadvantages in health. And for this, we look at the everyday social lives of 2S LGBTQ people. How are they treated by their family, their friends, by healthcare practitioners, by teachers and coaches, religious leaders, etc. And we want to understand if those interactions can either improve the health of 2S LGBTQ people, closing some of those gaps in mental health disparities, or unfortunately in some cases, are they contributing to poorer mental health, a process that we think of as minority stress, which is just kind of an accumulation of these stressors or worries that differentially affect 2S LGBTQ people, ultimately leading them to suffer.
So I'm in education, as we were talking about earlier, and there's certainly a lot of conversation and work in schools to ensure that students are protected and such. Do you work with the full lifespan of individuals, or what kind, how does that play out?
Yes, we, as much as we can, we look at a full lifespan approach. And in terms of younger generations of 2S LGBTQ people, we are interested in the messages that they're receiving in schools. We're fortunate here in British Columbia to have a curriculum embedded within our schools called SOGI 123. Our team is also now looking at sex ed. We're interested in the differences in how sex ed is delivered school to school. So for instance, we might have one school district that is able to hire in a professional sex educator or a peer sex educator who really has in-depth knowledge not only of science-based comprehensive sex education, but also of 2S LGBTQ issues. And they're able to offer something to those students that students may not get in another school district where they don't have the resources to actually provide that in-depth comprehensive sex ed. So we're starting to do interviews with educators in British Columbia to understand how do they actually learn to incorporate messages that are affirming of 2S LGBTQ people in sex ed. Of course, there's lots of other settings in that young people will encounter messages about their sexuality and gender, and so we still have a lot of work to do to understand that full landscape.
Oh, fantastic. When you started by describing the team that you work with, it sounds like a very diverse and rich group of researchers. So what's it like to work with that broad a group of researchers in a very complex project?
Yeah, it's a challenge because we don't always speak the same language, but the benefit is we bring different strengths. So we have, for instance, students and co-researchers and peer researchers who may not have trained in epidemiology like I have, but may have worked in social work or may have worked in counseling. And they're able to bring a perspective in terms of the person-to-person relationships and the personal to professional relationships that we need to understand. We also increasingly work with folks who do website design because more and more we realize that to reach as broad an audience as possible, we need to develop really effective internet-based tools for describing and understanding the landscape of 2S LGBTQ affirming spaces. So it's a challenge, but it's very rewarding to get to learn from people who bring different strengths to the team.
So you've done some work as a leading expert to the Federal Standing Committee on Health and Anti-Conversion Therapy legislation in Canada. Can you tell me a little bit more about that work?
I should start by defining conversion therapy because it means different things to different people. So when I say conversion therapy, I'm talking about some kind of sustained practice. The practice could be prayer, it could be quote unquote talk therapy, it could be a workshop. Lots of different forms it can take, but all kinds of conversion therapy share one common goal, which is to avoid an expression of a 2S LGBTQ identity. In other words, there are practices that start with an assumption that some sexual orientation, specifically heterosexual people, and some gender identities, specifically cisgender identities, by which I mean where one's current gender identity is aligned with the gender that was assigned at birth, that those are preferred to 2S LGBTQ experiences. When I first went to give testimony for the Canadian Parliament in 2019, the Standing Committee of Health was doing a study, quite a comprehensive study on the health of 2S LGBTQ Canadians. And the premise of that study was they were looking at epidemiological data and they were seeing those really large gaps in health, fourfold higher rates of suicide and 40-fold higher rates of HIV, and they were trying to understand, well, how do these health disparities persist after 30 years of enacting really some of the best, most progressive 2S LGBTQ affirming legislation in the world? And it just so happened that when I went to give my testimony for that committee, the federal government had turned down a petition to enact a conversion therapy ban. And my community partners at the Community-Based Research Center and I were sitting on some data that we just happened to have already collected that gave us an estimate of the number of Canadians who had experienced conversion therapy. And so I brought those data to the Standing Committee on Health. The members of Parliament had some very good questions. They wanted to know, where were people going to conversion therapy, and were they paying money for it, and were they being sent across the border to the United States, and at what age were they starting? And so those questions formed a research program that has really been the lion's share of my work my first 3 years at SFU, we worked with survivors of conversion therapy, we worked with 2S LGBTQ community agencies, and we tried to run, we did run a series of interviews and surveys to provide answers. And then in December of 2020, I had the opportunity to go back to Parliament, well, virtually by Zoom, this time to the Justice Committee to share all of those results. And the results actually were able to help the legislators come up with a much stronger bill to ban conversion therapy in Canada. It made it clear that conversion therapy isn't just going away to a prayer camp and praying away the gay, which is kind of a common stereotype, that it also includes practices that are embedded within healthcare interactions, where healthcare providers, for instance, will deny someone self-determined gender identity. It will also include groups that get together, let's say once a week, and just try to talk about behavioral techniques to avoid 2S LGBTQ identities. So we were able to present data showing really that conversion therapy isn't one thing, that it's a kind of a grab bag of different practices. We also, of course, presented data on the harms of conversion therapy, because we see that those who go through conversion therapy have to live with quite a lot of trauma and distress from it. And we showed data, quite importantly, demonstrating that about half of the people in Canada who start conversion therapy start it as an adult. And this was important because the first bill that was introduced back in the spring of 2020 really was focused on youth. And so by the time they came around with their new bill in this last session of Parliament, they were able to expand that and make sure that the amendment to the criminal code also applied to conversion therapy practices that were targeting adults.
Fantastic. So that's some quite important and consequential work that is making a difference in the lives of individuals then.
Thank you. Yeah, we're quite proud of it. And I should say, I mean, in addition to the students and research colleagues who supported that work, we couldn't have done it without conversion therapy survivors who had stood up and told their stories. Their sharing their experiences publicly, even though it was painful to do so, really opened the door for us to start to talk about this in terms of our research. So we're very grateful to them.
So it sounds like some of the data that you were gathering was done during the pandemic?
Yes.
What was that like?
Yes, well, oddly, it was kind of a benefit, because we started our interviews with conversion therapy survivors just before the pandemic in the spring of 2020. And we were doing those in person in Vancouver, Toronto, and Montreal, because those were the three places where we had research assistants set up to do the interviews. I work with colleagues at the University of Toronto and University of Montreal. When the pandemic happened, we had no choice but to switch the interviews to Zoom, and that had the added benefit of being able to interview people from right across Canada. So we were able to talk to people in the prairies, in parts of the Maritimes. We were able to expand the number of people we were reaching. We also found that, of course, COVID changed the headspace of all of us, but for survivors of conversion therapy, healing and recovering from that trauma didn't stop just because there was a pandemic. And so we were actually able to talk to them at a time where they felt heard, and they felt like someone who understood the trauma of what they went through, that we understood how serious it was, how wrong it was, that we were able to listen to them at a time when maybe others weren't available to listen. So there was a certain benefit, I think, to doing the interviews in 2020, notwithstanding the challenges of the pandemic.
Right, great. Yeah, that's one of the really interesting things is research always runs into bumps in the road, right? And,
yes.
And how you're able to handle them and turn them into something that was helpful. Yeah,
yes.
That's great. So can you talk a little bit, obviously there's a lot of intersections of your work with equity, diversity, and inclusion. So can you talk a little bit about how your work supports equity, diversity, and inclusion in a post-secondary education?
Yeah, absolutely. So I am myself a queer man, and I did research during my PhD on other queer men. And so I know firsthand the rewards and challenges of doing research on a topic for which you have lived experience. And most of the students that I work with now also come from that perspective. They're motivated to do research about 2S LGBTQ health because they either themselves identify as 2S LGBTQ, or they have a loved one who does and perhaps has struggled. And so they're very motivated. And so what I try to do in my research lab at the Reaffirm Collaborative is to create space for people to bring their personal experiences and their personal reflections. Sometimes in the research discipline where I was trained in biomedical epidemiology, we tend to think that we need to take a very purely objective stance in research, that we have to be able to separate our personal biases from the data that we're collecting. In the kind of social epidemiology work that I do, we instead say, no, those personal experiences, quote unquote biases, actually can be a strength. It doesn't mean that you don't acknowledge them. You still acknowledge them and you understand how they might motivate the questions that we're asking and how we frame our research. But we welcome those experiences. And that's something that I've found, at least so far, is really a big benefit from an equity and inclusion perspective. It means that someone who might feel a little bit out of place on another research team can feel at home in our research lab.
Yeah, that's fantastic. As an education researcher, we deal with the same kind of thing, right? That being able to recognize and understand your own experiences and how they interact with your research question, your data gathering, and your analysis. You can't do that. There is, it's very difficult, if not impossible, to achieve true objectivity in the research that you're doing.
Absolutely. We all come to our work with our own forms of bias. We're all creatures of our own training and our social environments, and so rather than try to partition that off and deny it, we try to bring it into the work as best we can. I should note that the other benefit of that is it gives us access to networks. So, for example, I work with students who are Indigenous and Two-Spirit who are connected to Indigenous and Two-Spirit communities that I myself, as a settler, don't have access to. I work with another student who's non-binary and is doing research on experiences of non-binary people in sports. Again, as someone who is cisgender and someone who doesn't participate in sports, I don't have access to that. So I think when people bring their personal experiences and passions and curiosities, it really gives us access to a lot more research opportunity.
So it's a very rich research field that you're working in with lots of opportunity to make a difference.
I think so.
Yeah, great. So that's actually a really nice transition. So what are some of the intersections between your work and the calls to action of the 2015 Truth and Reconciliation Commission report?
Yeah, thanks for asking that question. The Truth and Reconciliation calls to action have specific calls for those of us working in the health sector, and they call us to acknowledge and understand the ways in which colonization has contributed to some of the health outcomes that we see that particularly affect Indigenous communities, and they ask us to monitor them and to actually hold our healthcare system to account to improve that. I'll just briefly talk about my work with Two-Spirit communities, and I have to especially acknowledge one of my graduate students who's also a community organizer in the Two-Spirit community, and that's Harlan Pruden. And Harlan has opened the door for me to really look at what it is that's very unique about Two-Spirit in an Indigenous context. So just briefly, I'll try to give a definition, which is that before the arrival of Europeans to Turtle Island or North America, many Indigenous cultures had roles for people who were gender diverse, people that today we would think of maybe as LGBTQ, but were conceived in very different ways in pre-colonial societies. Those roles were in many cases lost or nearly lost through the process of colonization. We know that the residential schools, in addition to stripping Indigenous people of their cultures and connections to family, also reinforced really binary notions of gender. Boys go over here and have your hair cut short and dress like this, and girls go over here and you behave this way. And that had a really terrible effect of leaving generations of Indigenous children without that connection to their culture that would have otherwise made them feel included and affirmed in their sexuality and gender. So Harlan and I co-facilitate a group called the Two-Spirit Dry Lab. It's kind of working in collaboration to the Reaffirm Collaborative, but with an explicit focus on Indigenous, Two-Spirit, and other LGBTQ Indigenous people. We try to collect data that better explain the social conditions and the health of Two-Spirit people, and we try to understand what it is about Two-Spirit that facilitates access to health. We're seeing a remarkable resurgence of celebration of gender and sexual diversity in Indigenous communities. There's numerous Two-Spirit Indigenous-led groups and services, social and health services happening right across British Columbia. So it's a fantastic time for us to be asking the question. And I think for me as a settler, there's a lot that I can learn from Indigenous Two-Spirit leadership about how do other conceptions of sexuality and gender diversity maybe enrich our understanding of humans and human health.
Great. So I've enjoyed talking with you today. That's kind of the end of our formal questions. Is there anything else that you'd like to add regarding your research or regarding the award?
Yeah. Well, with regard to the research, I would just say that we should be proud that as of January of 2022, conversion therapy is now a crime in Canada. Our federal leaders have unequivocally shown us that these practices are incompatible with Canadian values. But we still have a lot of work to do. We know that there's limits to how the criminal code can actually be enforced. And so I believe that the next set of work that we need to do, and all of us can do this, is really education in communities, in schools, and in our homes, really to let people know that whatever their sexuality, whatever their gender identity, that they are loved, that they are good the way they are. And I think that will take a lot more work beyond just passing the bill. But our team is prepared to do that work, and we're really grateful to have partners who are supportive and in line with that goal. So to the people who wrote kind words to nominate me, I'm very grateful for the generous and kind words, and to the selection committee, thank you for acknowledging the value of this work, not just work that I've done, but work that I've done in collaboration with a large team of 2S LGBTQ community members and co-researchers. So just really, really honored by the acknowledgement, and happy to be here talking with you.
Well, it's fantastic work, right? When we take the work that we do as part of our research agenda and we're able to actually change federal legislation to support the outcomes of that work and to protect people and make the difference in the lives of thousands of people well into the future, that's powerful stuff. And it's definitely worthy of recognition. So thanks for the work that you do and you will continue to do, and we celebrate in your success.
Thank you so much, Dan.